Mitchella repens is called partridge berry commonly. It used to be called squaw vine, but squaw is a derogatory word for a female Native American that is of childbearing age. So we don't use the term squaw vine anymore, although you will still see that written in a lot of the older textbooks. So the part used is the herb, which means we can use the entire aerial parts, the stem, the leaf, and the flower. The action is specific and parturient, which means that it helps promote labor and delivery of a baby. It is astringent and it goes to the reproductive and the hepatic systems. It is bitter cool. And we really use it mainly to facilitate childbirth, which is how it got the name squaw vine to begin with. And also to treat dysmenorrhea, which is painful menstruation, and amenorrhea, which is a lack of menstruation. The caution for this plant is to not use until we are close to the delivery date. So you want to avoid in pregnancy until you're ready to give birth. We generally use it in an infusion or a tincture. The dosage for an infusion would be 2 to 3 grams up to 3 times a day. And the tincture dosage is 1 to 3 mils, 2 to 3 times a day. So this plant is great at treating menstrual irregularities and also threatened miscarriage, which is counterintuitive for the fact that we just said to avoid in pregnancy unless you're ready to give birth. But in very small doses and with the right practitioner, you can use this for threatened miscarriage. Although for our purposes, we're going to say avoid in pregnancy until you want to have the child. Definitely used by several Native American tribes to prepare the uterus for childbirth. Eclectics considered this herb to increase the tone of the uterus. Although studies haven't really shown that it is a uterine tonic, that's what eclectics used it for. And although we've talked about all of these things for the female reproductive system, this can work for males when they have BPH, or what is called benign prostate hyperplasia, due to a sedentary lifestyle. So if you have BPH due to a hormonal issue, Mitchella is not really going to work. But if your BPH is due to a sedentary lifestyle, like you work at a desk all day long, then Mitchella can definitely help reduce the inflammation of the prostate gland.